Next, I'm going to go over the abbreviations and terminology. So, laminectomy, lamina is a portion of the posterior part of the vertebrae. Ectomy means to remove, so removing the lamina. It is a surgical process, and the one that my patient went through. HTN or hypertension, just meaning that you have high blood pressure. Diabetes mellitus is a disease of the pancreas where it does not produce insulin, therefore having a difficulty regulating glucose levels in the blood, which can be very dangerous for survival. Strokes are occlusions or bleeds in the brain that obstruct and they create some type of dysfunction, whether it's musculoskeletal or neurological with the muscles, neuromuscular, and epilepsy is a seizure disorder, meaning quick contrast can start, it can kind of like, basically it triggers a switch in your brain to reset. And this is a specific one with the type of stimulus that induces the epilepsy. O2 sat is your oxygen saturation, so how much oxygen is saturated in the blood. And then you have your, BID, so that's bi-daily or 2 times a day. RSLR stands for right leg, it's right single leg raise. RLE is right lower extremity. A dermatome is basically a place on the skin where you have sensation. So in my patient's report, it talks about an RLE, so there's that right lower extremity abbreviation again. L3 to L5 dermatome. So essentially this is on the lower extremity, primarily the front, lateral, the anterior, lateral, and some of the superior aspect, medially as well, but you've also got S1 through S5 that are in that area too. And I'm just going to make sure that I've addressed. ROM is range of motion. This is something that we test just to see if you are in what is a norm range. So if you have an unaffected or a side that is not injured or does not have the dysfunction, typically as the therapist we will measure that side. That will be within your normal limits. Also, abbreviated sometimes WNL or WFL within full limitations, which just means that this is what your body is capable of doing. So you will also see that presented as AROM, active range of motion, PROM, passive range of motion, AROM, active assisted range of motion. Those kind of describe themselves, right? Active assisted, you're assisting a little bit with that active motion. The active motion is completely independent, while the passive motion is completely dependent. And these markers or these objective measurements are ones that we just use kind of to gauge the progress of our patients. Speaking of objective measures, two tests that I performed in my session after this evaluation was the single leg raise for both right and left, and a manual muscle test for just the extensors, so primarily gluteus maximus. I did see an improvement in the strength of the gluteus maximus test. Basically, your patient is lying prone. You ask them to elevate their leg. If they can do it on their own, that's a 3. If you can add a good deal of resistance, that's a 5. Anywhere in between that is a 4. Below that is where we see dysfunction. My patient right now has been at a 2 minus, but a 2 positive. They were not able to fully resist they couldn't handle my resistance at all and had a hard time keeping the leg up, but they were able to partially lift it, as well as just checking the degrees in that single leg raise. So the patient will lie supine on their back, knees are to their chest, one leg extends while the other stays bent, and we just measure that degree and how far it is. I believe that there were other tests done, but again, I just wanted to address the ones that I felt pertinent because I'm seeing progress in those other areas. So for the other muscles that work in the leg, the quads, hamstrings, those are all about a 3 already, so they're pretty strong. And the active range of motion was not given, and passive range of motion, it was pretty much the same. So there wasn't really much of a change in range of motion, which is why that was also something a little bit more focused in this treatment plan today, as well as a combination of strength.